So our next speaker I'll introduce, and we were chatting beforehand. I reached out to Kasley. We couldn't work out how many years ago it was. She was writing articles mostly, I think, at the time, and shortly afterwards I invited her to speak at a conference, and she went and got a job at Google and then couldn't come speak. So I finally, it's been ever since then, it's been a dream of mine to share a stage with her. I'm still not there yet, but at least the screen is something. And I think, so looking forward to this session. And as I mentioned at the top, we've got a great variety of speakers here today. And I think one of the things that sort of I think makes Kasley so interesting and such a treasure to have her with us today is that she both has been very active in terms of research into the issue of loneliness, a real pioneer in the field, but also has done a lot of practical stuff in the area as well. So she's really very much on the front lines, and has been working to if one were to add up all the human connection that she's created over the years, it would be a heck of a lot. So she's the founder of Social Health Labs, and she's going to be talking about social health, addressing the missing dimension of well-being. So Kasley, great to see you, and the screen is yours.
Thank you so much, John, and thank you to Pete and Kiffer for the invitation to speak with you all today. I've been really looking forward to this conference. So as John said, I will be presenting today on social health, the missing dimension of well-being, and I could not be more thrilled to present on this topic. So I'd like to start off just by introducing myself. My name is Kasley Killam, as John said. I'm the founder of Social Health Labs, a nonprofit here in the US. I'm also a writer of the social health blog for Psychology Today, and I am working on a book on the same topic that should hit bookshelves in 2024. Formerly, I was at Google, like he said. I did also studied loneliness at the Harvard School of Public Health. So that's a very quick synopsis of some of my background and the lens that I'm bringing to this work today. So I'd like to kick off by inviting you to reflect on a time in your life when you felt lonely. Think about a stage in your life when you felt lonely, and how did that actually feel? What was the sensation inside your body? And next, I invite you to do the opposite, to actually reflect on a time in your life when you felt the most meaningfully connected, when you felt like you had a strong support system around you, and like you really had a good sense of belonging. And maybe that's now, or maybe that's at a prior time in your life. Reflect on how that felt. Did it affect different parts of your life, like your happiness, your productivity at work, your academic success at school, or perhaps your health? I love this example of a tweet that I saw recently, actually by a Canadian politician, who shared a proud dad moment today. My 10-year-old son saw a new kid sitting by himself, another friend, and he decided to hang out with him over lunch. He got this lovely note at the end of the day. And the note says, "Sitting with me outside felt better than anything. Thank you so much. I would like to ask if I can start joining you guys outside." So I love that because it illustrates exactly the point that I'm trying to make, which is that it feels really good to feel included, to feel supported, and to feel like we have a sense of belonging. And as we're going to discuss today, how lonely or connected you feel quite literally gets under your skin. It changes your physiology and affects both how long you live as well as how well you live. So today I'm going to be talking about the why, the what, and the how of social health. All right, so first off, the why. So if you look back over history, you can see how humanity's understanding of health has evolved. It started really with physical health, focused very much on our bodies. Over time, we came to understand that our bodies are influenced by things like what we eat and how much we exercise. We take that knowledge for granted now, but we had to learn that at some point along the way. It's now common knowledge that you should not smoke, for example, and that you should aim for 8 hours of sleep each night, as another example. So this is something we're very comfortable with. Now, eventually, we advanced to understand mental health and really focus on our minds and emotions. We came to understand that our thoughts and our feelings influence our well-being and that we have some agency over them. We can train them. Nowadays, therapy is popular, meditation is mainstream. And again, the fact here that physical and mental health are terms that we're all familiar with is really thanks to hundreds of years of discovery and advocacy by scientists, doctors, policymakers, and many others. And it's a true achievement that we've come to understand both of these in the way that we do. However, something is missing from this conversation. We've been so focused on our bodies and on our minds that we've overlooked one of the most important parts of our overall health, our relationships. Human connection determines how well and how long we live, as we're discussing today. Decades of research have shown that human connection is one of the biggest determinants of physical health, mental health, and longevity. It predicts whether or not we will develop heart disease, depression, and dementia. And like I said, it contributes not just to how healthy we are while we're alive, but also actually to how long we live. So to give a few examples of this research, and we've heard some of these already this morning, studies have found that when you feel really connected to other people, you have less inflammation, you have a lower risk of heart disease and stroke, lower blood pressure, lower cholesterol, and a faster recovery time when facing illness and disease. Similarly, people who are meaningfully connected report higher life satisfaction. They have more meaning and purpose in their days. They're less likely to experience depression and anxiety, less likely to consider or actually attempt suicide, and they're slower to experience cognitive decline in the later years of their life. And finally, perhaps most dramatically, people who are more meaningfully connected have an increased likelihood of survival, a longer lifespan, and the mortality risk of the opposite of isolation and loneliness is similar to that of smoking and drinking, and actually worse than that of physical inactivity and obesity. So we can see that there's a huge, huge impact here, truly in our bodies, minds, and lifespan. What all this means is that human connection is not a nice to have, it's essential. Yet too often we undervalue it. We lump it under the conversation on mental health when in fact it impacts so much more than just mental health. And as we heard from the speakers this morning, oftentimes friendship and time socializing are the first things to go when we get busy or just when we're not intentional about prioritizing them. So given all this evidence, it's time to really advance our understanding of health even further and recognize a third pillar, which is social health. So note that all of these are interconnected, of course, right? Being socially healthy helps your physical and mental health and vice versa. But it can be really helpful to distinguish because that means we can do different things to strengthen each and thereby strengthen our overall health. So I define social health as the dimension of well-being that comes from connection and community. Whereas physical health is about our bodies and mental health is about our minds, social health is about our relationships. Note that this is different from the social determinants of health, which is a term you often hear in public health. That refers to the economic and the environmental influences on people's well-being, such as housing and education. What I'm talking about with social health is really focused on our relationships and our sense of community. So my work over the past decade, which includes studying solutions for loneliness at the Harvard School of Public Health, interviewing over 50 researchers and innovators, launching programs, products, and publications that put the research into practice in the real world, and engaging with tens of thousands of people around this topic through articles and talks, has led me to believe that social health is one of the most powerful and transformative ideas. Yet, as recently as 2 years ago, I was one of the only people using the term social health, and it was a little bit lonely. I'm really glad that that has been rapidly changing, and it's frankly incredible to see this idea spread, and I think that you're going to hear a lot more about it in the years to come. And we need it. We really need social health. A study published last year looked at data for over 1 million teenagers in 37 countries that surveyed them from 2000 to 2018. They asked them questions like, how much do you agree with the statement, I make friends easily at school, or I feel like an outsider at school? Their answers stayed the same for roughly the first decade, but took a turn for the worse in 2012. And by 2018, nearly twice as many adolescents reported feeling lonely at school. Similarly, Gallup published a global emotions report just a few months ago after interviewing nationally representative samples of people in 122 countries. They found that 330 million adults go 2 or more weeks at a time without talking to a single friend or family member. Similarly, they found that 20% of all adults worldwide don't have a single person they can count on for help. Let that sink in for a moment. That means 1 in 5 people, perhaps 1 in 5 of you listening in, feel like there's no one that you can truly lean on. In turn, this social illness has downstream consequences, right? In the US, for example, Medicare spends an estimated $6.7 billion each year just for healthcare costs for isolated older adults. And that's just the tip of the iceberg. There's also evidence that this trend is getting worse. We heard a little bit about this from Kiffer earlier, but as you can see here, Gen Z has the highest percent of people who say they felt lonely every single day, a couple times a week, or once a week while growing up. That's higher than any other generation in recent memory, and really staggering and worrisome. So with that, let's now switch to talking about the what of social health. I already shared my definition, which is the dimension of well-being that comes from connection and community. But let's talk about what that really entails. And I'd like to share a few principles of social health. The first is that whether or not you feel connected and your preferences for connection are both subjective, right? So to make an analogy with physical health, your ideal weight, ideal cardiac output, your muscle strength, all of those things might be very different than my ideal weight, cardiac output, and muscle strength, right? We have different targets that we're aiming for in terms of our physical health. The same is true for social health. I might prefer a deep conversation with a friend over dinner, whereas you might prefer going to a party, a loud, boisterous event, and socializing with tons of people. So only we can really know what's nourishing to us and whether or not we feel connected, whether or not we feel socially healthy. A second principle is that the quality of your relationships matters more than the quantity of your relationships. That's not to say that the number of close friends and loved ones doesn't matter. It's just to say that the quality is more important. That's because you could feel lonely in a crowded room surrounded by family or friends if you don't really feel seen and heard and understood in a meaningful way, or if you don't feel like you can be your authentic self with those people. And similarly, you might be perfectly content while by yourself, while alone, enjoying the solitude and still feeling connected to other people, to your loved ones from afar. A third principle of social health is that it comes not just from our one-on-one relationships and interactions with family, friends, neighbors, coworkers, our spouses, but also from a broader sense of community, right? It's not just those individual interactions, but also belonging to groups. Those groups could be the neighborhood where you live, your workplace or school where you spend your days, or part of your identity, like being a new mom or practicing a certain religion. Now, there are other key principles of social health that I'm not going to delve into today, but you can find them in the months to come. I'll be sharing a lot more about this in articles as well as my forthcoming book. I think what's important to recognize is that the pandemic really catalyzed a social reckoning, right? Wherein everyone now has been forced to think about human connection in a new way and to recognize how much we value our relationships. That, as a result, has created the conditions for more and more people to start talking about this and realizing that if they didn't already have strong relationships in place, they were in trouble. I am a big advocate of reframing the conversation. Too much time is spent talking about how we can address isolation and loneliness, and there's tremendous power in reframing from what's been going wrong to what can go right, from fixing deficits to building assets, and from taking a reactive approach to taking a proactive approach, right? We can be much more imaginative and generative around novel approaches to both lessen widespread loneliness, but also prevent it in the first place and build up social health as a resource moving forward if we take this kind of mindset shift and pivot the conversation in this way. So 2 examples of the importance of that asset-based proactive approach come from the pandemic and from Hurricane Ian most recently. So looking at the pandemic for a moment, there have been quite a few studies in multiple countries showing that communities with stronger social ties actually had fewer cases and deaths from COVID-19. I wrote about this in an article for the American Society on Aging earlier this year and included some recommendations for how policymakers, city officials, community organizations, and individual citizens can invest in social health proactively so that we can be more resilient in the face of future pandemics, of future natural disasters, and of course, for climate change. A second example here is from Hurricane Ian most recently, as well as, unfortunately, hurricanes over the past couple decades. Unfortunately, a disproportionate number of deaths in hurricanes is older adults who are isolated and alone in their homes. I wrote about this just last week in a letter to the editor published in the New York Times, where I argued that our emergency planning efforts need to include building connections across ages at the local level. We need to be investing in social health upfront so that we're better prepared in times of need. And really, that's because everyone needs social health, right? It's not just people who are lonely. And similarly, everyone can benefit from strengthening their social health, not just during the pandemic. So with that, let's move on to the how of social health and really ask ourselves, how can we as individuals and a society be more socially healthy? As we take part in the conversations today and tomorrow at the conference, as we lead initiatives at our respective organizations, and just as we interact as family members, as friends, as neighbors, as partners, let's ask this question and figure out the answer together. But I'd like to kick off with offering a few different answers myself. So first, we need to make social health a priority. Whether or not you've heard this term before, or if you use it all the time, it really just takes being intentional about our social health. That means deciding that you care about your relationships, that you realize the impact that they have on your health, longevity, and overall ability to not just survive, but also to thrive. It means consistently making time for the relationships that matter most, and then modeling that to our children, as you can see in the photo here. That's the first step, and I think all of us who are attending this conference today are already well on our way with that one. Second, we should take small steps to strengthen our social muscles on a daily or weekly basis. What I love and what we've heard a little bit about already today is that research has shown that very simple gestures can be really effective. For example, there was one study recently that looked at talking on the phone for just 10 minutes a few times a week. And they found that those simple conversations, just 10 minutes a few times a week, significantly lowered people's levels of loneliness, so their social health, but also depression and anxiety, their mental health. In another study, researchers invited users of the app Nextdoor to do small acts of kindness for neighbors over a 4-week period. At the start of that 4-week period, 1 in 10 participants felt lonely. And then at the end, after doing all those simple acts of kindness for neighbors, 1 in 20 felt lonely. So it significantly decreased their levels of loneliness and made them feel more connected to their community. The same is true for volunteering and getting more involved in your local neighborhood, or perhaps with an organization whose mission you feel passionate about, right? Volunteering is such a powerful way to build new friendships, build new connections, and strengthen your social health overall. So you can find a lot more evidence-based recommendations like these on my blog or in my newsletter by visiting KasleyKillam.com. Another example that I really love of this comes from this tweet I saw recently, which says, "Last night I told my elderly neighbor who has lived here for over 40 years that I was having a yard hang and he should call if the music was too loud. He waved me off, and then it suddenly occurred to me that I should invite him. By 8 p.m., he was eating an ice cream bar and chatting with my friends by the fire pit." She goes on to say, he took off at 9:30, thanking me for the invite. He lives in a big house alone, far from family, and he told me it had been a wonderful time. I really needed this, he said. Today he called to ask if he could help clean up. I told him we were set. Now we're starting a dinner club. I love this because it's such a simple gesture, just inviting someone in your neighborhood who lives alone and might benefit from that social connection, and look at the friendship and now dinner party that it has spawned. Another example is that each month at Social Health Labs, we give out $1,000 to support a community builder who has an idea for a project to build relationships and improve social health locally. So for example, Emily is bridging divides between residents and new refugee families in Alaska. Stephanie is reducing loneliness among parents in a rural area in Arizona. And Alexander is forming friendships across people of all different abilities in Pennsylvania. So this program is currently just based in the US, but I do hope to expand to Canada and other places soon. What these people's stories have demonstrated to me and to others is that anyone can take initiative and bring people together in their community, right? These are just everyday people like you and me who are doing this not for their day jobs, but simply in their spare time because they care. So the third suggestion is that we need to become more socially healthy as a society by taking a very comprehensive approach. Every individual, every community, every organization has a role to play in improving social health. So drawing inspiration from the field of public health, since loneliness is indeed a public health issue, we can identify different opportunities for intervention and impact. What you see here is a very basic version of the social ecological model for prevention used in public health. And what this shows is that we can take action at the policy level, right? Through national, state, or provincial and local legislation. We can take action at the community level in our cities and neighborhoods and through the different resources and social norms that exist. We can take action at the institutional level in the organizations, schools, and workplaces that we frequent every single day. We can take action at the interpersonal level with the friends, family members, and social networks around us. And last but certainly not least, we can take action at the individual level by changing the knowledge, attitudes, skills, and behaviors of people. So I'll share a few examples of this in action. One is that in government, right, we need more legislation that's written with social health in mind and more funding allocated towards strengthening social health at the local level. I think a couple interesting examples of this are the ministers of loneliness that have been appointed in the UK and Japan, but I do wish they had been named the ministers of social health so that we have that positive asset-focused framework and so that it's recognizing that relationships are important for everyone, not just those who are lonely. Another example comes from healthcare. Right? So we need more doctors who are screening for isolation among their patients and then prescribing social engagement where appropriate. A couple examples of this are the Togetherness program at CareMore as well as at Scan Health Plan down in the US. Next example is in urban planning, a personal interest of mine. Cities really need to be designed with features and physical gathering spaces that encourage interaction and bonding. So a great example of this in Canada is the work of the Hey Neighbor Collective in Vancouver, and there are many others adopting this kind of mindset elsewhere too. In technology, social media, of course, I think we can all agree, needs to be really overhauled to optimize not for the quantity of engagement, but truly for the quality of engagement. And also to ensure that everyone has access to and the skills they need to use technology. So a couple examples of this are apps like Gather Round, as well as platforms like Secure Senior Connections, where they're really designing for technology to help people connect in more meaningful ways. And then finally, a last example is that in education, right? Teachers have a tremendous opportunity to create supportive classroom environments, to teach social skills and other tools that will help kids then grow up to be socially healthy adults. I know I wish I had that kind of training when I was younger. A couple examples of people doing work in this space are the nonprofit Beyond Differences and Only 7 Seconds, which are both doing great work in terms of developing curricula for schools to help kids be more socially healthy. This may seem like a lot, but I am very happy to say that all of this is underway. There has been a huge influx of innovation and action in Canada, in the US, and in countries around the world in the past couple of years. And I truly believe that this is just the beginning. We're also going to be hearing about lots more examples in the conference over the next couple of days. And earlier this year, Social Health Labs published a report with the Foundation for Social Connection called Creating the Conditions for Social Wellbeing. So if this kind of comprehensive way of thinking is interesting to you, you can find more tangible ideas for those sectors that I mentioned, as well as others, by downloading it for free at socialhealthlabs.com. This includes recommendations from a series of conversations that we hosted with 26 experts and over 2,500 community members from 55 countries. So there's some really compelling insights in there. So in closing, I've shared a relatively brief overview of why social health is so important, what social health actually looks like, and some ideas for how to become more socially healthy as individuals and a society overall. I really invite you to join me and to join everyone here today in making the future of health social. We are never going to make the world less lonely and more socially healthy if we do it alone. And so with that, please reach out and share your reflections on what I've presented today. I would love to know how the idea of social health resonates with you, and I would love to connect with you. So thank you so much.
Well, thank you, Kasley. While you were speaking, I checked my email. It was early 2016. So that's when I first reached out to you. So well worth the wait. I hope I don't have to wait 7 years to be on stage with you.
Me too, John.
We do have a couple of minutes, and I know Pete's certainly wishing he was on camera right now, because I know that you hit the core of where he's his philosophy for the GenWell is to focus on that positive and the like. But so there are a couple of questions here. One issue that Avery raised here, and I think one of the biases we have is we tend to associate sort of loneliness with old people. I think generally, tell me if I'm wrong, but I mean, you're saying a Gen Z, suffering from loneliness. I know I've seen other studies that sort of confirm that. How much of a part of that do you think is technology? Is a greater reliance on technology for connection versus face-to-face, in person?
Well, it's really an interesting question, because the technology piece plays out differently for Gen Z versus older adults, right? With older adults, a lot of times the issue is that they don't have access to, or they don't feel comfortable engaging and using technology. And so they're not able to tap into that resource in the positive ways that we can use technology to connect. And then conversely, with younger groups, it's kind of the opposite problem where maybe they're using it too much, or, a lot of the technology and social media is designed in ways that are addictive and unhealthy and not enabling us to really make the most of our relationships and connect in meaningful ways. They're designed for different purposes. So I think it's playing out in different ways, and we need to address both of those.
Yeah. Well, I was hosting my first live event for a number of years, like a couple of weeks ago, and I have these slides about turning off your phone, and I'm saying, people don't phone people anymore, right? I mean, they tend to text, and almost asking people to turn off the ringer on their phone is almost like, I can remember back in the day, giving them the fax machine number for the hotel. I mean, is it that those simple choices around the media we use can have quite a big impact as well, can't they?
Yeah, it's interesting because, I'm all for having less screen time and less phone time as well. And yet most of my friends and family live in other cities and in other countries. So I actually rely on that as a tool to connect at all, let alone in meaningful ways. And so I think we're all playing around with that tension. And I think we're just very early in the trajectory of where that's going to go.
Yeah, I think you're right. And I think that there's clearly a lot of momentum building around this, and I think that focus you have on it being for everyone. I'm thinking that I've got a little riff going here that based on Thunder Road by Bruce Springsteen. Roy Orbison sung for the lonely, but social health isn't for them only. So there's
John, that's amazing.
I thought I'd throw that in there. So
someone write that down so I can remember that. That's great.
I have it written down. It was great hearing you. Thank you so much. Really appreciate you joining us. When is the book coming out? I know. I'm sure people are itching to go to Amazon and see if it's there yet, but it's not.
Thank you. I wish it was. Yes, it's such a long process. It won't be until likely spring 2024, but definitely if you're already subscribed to my newsletter or follow me on social media, you'll be among the first to know about it, and certainly do that if that's of interest.
Okay, well, thank you so much, Kasley, and thank you for joining us. It was great to see you here today. We now have a break for lunch, so we'll be returning at 1. So go outside if you have the opportunity. Go outside into nature. Maybe go, if you go next door and have a quick chat with your neighbour. So whatever you do, don't have sad desk lunch. That's one of the things that you have to avoid. It kills you. So we will see you back here at 1 o'clock, and looking forward to the rest of the day. Thank you very much.